This program financed and brought to you by the staff of the McCollough, Grotting, Russo and Associates Plastic Surgery Clinic, a Genus affiliate.
There's a famous quote by one of the earliest plastic surgeons in the Middle Ages by the name of Tagliacozzi, who referred to the process of plastic surgery as buoying the human spirit. And probably more than anything else, that's what we accomplish.
Plasticos, a special report on contemporary techniques in plastic surgery. The term plastic surgery is derived from the Greek word plastikos, which means to mold or to shape. If you thought plastic surgery got its name because it involves plastic, you're not alone. It's a common misconception. In truth, the surgery requires very little, if any, plastic materials. One of the earliest recorded examples of plastic surgery occurred around 600 BC in India, where Hindu surgeons used skin from patients' foreheads to reconstruct amputated noses. In the next half hour, you will learn the current techniques of plastic surgery. You'll also learn what's working, the pros and cons of various procedures, and how to find out if you're a good candidate. Helping explain the current procedures from the McCollough, Grotting, Russo and Associates Plastic Surgery Clinic are Dr. Galen McCollough.
Well, that tends to bring the cheek forward and can either correct a congenital
Dr. James Grotting.
Appearance to a more transverse appearance, and in the older individual,
Dr. Daniel Russo.
Continue to grow up there as well, even though they may lose the hair on the top of the head.
Dr. Grady Core.
Applies a very controlled amount of energy.
We communicate.
Dr. Darrell Wolfley.
Primarily looking at each other's eyes.
Into a position
and Dr. Michael Clinton.
The lady has been used to, actually, during her adolescence or early womanhood.
Plastic surgery has the capacity to greatly improve a person's quality of life. When one looks better, pride and self-esteem are bolstered, and the confidence that results from a person's new appearance often improves personal relationships. The truth is, perfection is rarely achieved. Plastic surgery is designed to improve imperfections.
A good plastic surgeon isn't going to change you totally. He's going to enhance what you already have, which is good surgery, which is what you want. You ought to have an idea in your mind that what you want is not to look like Cindy Crawford. You want to look like yourself, and you want your surgeon to make you look like the best you.
While it sometimes works wonders, there are practical limitations to what surgery can do for each individual. Dr. Galen McCollough, one of the world's foremost facial plastic surgeons, explains.
Any patient looking into having plastic surgery ought to come with realistic expectations. That is, that surgery can rarely achieve perfection. We generally take the condition that's present and can make it better if everything goes well. But a surgeon cannot guarantee the outcome of an operation. There are a number of imponderables that come in: healing, infection, scarring. That sort of thing is very difficult for anyone to be able to predict prior to the operation.
In general, plastic surgeons advise patients that if all variables surrounding surgery go well, the end result should be 1 or 2 steps higher than the condition which existed prior to surgery. These photos illustrate this one-step theory. Plastic surgery has brought this patient up 1 step in appearance from average to good. In searching for the surgeon most qualified to perform your surgery, you should examine a physician's credentials, board certifications, and compare their experience with the exact procedure you want. Ask your own doctor or other doctors for opinions on your choice. No ethical surgeon can guarantee the outcome of surgery.
While most procedures that we perform in aesthetic plastic surgery have a very high degree of predictability, no plastic surgeon can guarantee the result. There are a number of factors that come into play. Certain types of tissue heal differently. There are variations between people, between races, and these are the kinds of factors that make it so that no plastic surgeon can guarantee the postoperative result.
Once a patient decides on a particular procedure and a physician, the next step is a one-on-one consultation with that physician. This consult allows the patient to interview the physician, and it also gives the physician an opportunity to demonstrate his or her plan for improvement.
Leonardo da Vinci, many years ago, devised an ideal scale of what the ideal facial proportions are. And if a patient is trying to decide what those should be, the face is divided into thirds, for example, with the hairline and the eyebrow being the upper third, the eyebrow to the bottom of the nose being another third, and the bottom of the nose to the jawline being the lower third. If one of those proportions is out of sync, then we have a face that is not as aesthetically pleasing to the human eye.
Many clinics, like the McCollough, Grotting, Russo and Associates Plastic Surgery Clinic, use computerized imaging to help patients better understand their options. Photos are taken from several different angles and scanned into a computer. Then a computer artist manipulates the photos. Later, when the patient meets with his or her physician, the computer imaging is used to help illustrate potential outcomes.
The patient and the physician may not always have the exact same idea about what would constitute a good result. The computer imager allows us to demonstrate to the patient what would be considered an ideal aesthetic result, and it also allows us to show them what they would consider to be a good result, and they can have an opportunity to compare the two.
I had the facelift, a chin implant, which for me was very important. I didn't know it at the time, but when I came to see the doctor, he said, well, you need that before you do anything. Well, see, I didn't know that. And I think that's what's good about going in for a consultation. You get a chance to really understand things you wouldn't have known if you didn't go in and talk to them.
Most surgeons agree the one-on-one consultation is a critical component of plastic surgery.
What about hair loss, incisions in the hair? Is that a problem?
The initial